My name is Alicia Duncan, and I am here to warn people what can happen when state-sanctioned euthanasia goes wrong. I know firsthand about this experience because my mom's life was ended through medical assistance in dying in Canada in 2021. 18 months before my mom's passing, she was in a minor car accident and suffered a concussion. Prior to this accident, she was a loving, joyous person. She was a psychiatric nurse. She worked in her community. She had recently retired but was still working part-time. She was a huge part of our lives. She was involved in my children's lives. And it was really shocking for our family to see my mom go from this person to the shell of a human being she was when she passed. The doctors couldn't figure out why she was losing so much weight. They tested her and ruled out everything from cancer to fibromyalgia and everything in between. My sister and I started speculating that it was psychosomatic and that she was not eating enough, that she was starving herself. And we found out that she had applied to die 2 days before her first scheduled appointment. We had no idea what medical assistance in dying was. We thought this was for someone who was terminal, and we couldn't believe that my mom had been approved and was going to die in 48 hours. When we found out that my mom was going to die in 48 hours, we didn't know what to do, so we called the police. And the police informed us that all of the paperwork was in order. We couldn't believe that this was the case because my mom wasn't terminal. She had no diagnosis other than depression and a concussion. And the police, because they couldn't do anything because the paperwork was in order, they told us we needed to get a warrant for her arrest under the Mental Health Act. And so we went to the courthouse the next morning, and that's what we did. We provided enough evidence to a judge to show that my mom's mental health and her state of mind should be in question. My mom was so devastated that we were able to stop her MAID appointment that she attempted to take her own life, and she slit her left wrist. And it's really difficult to truly explain the relief that you feel when your family member is sectioned in a mental health unit, but only because it's to save them from themselves. And in an ironic twist of fate, my mom was sectioned to the psychiatric unit that she used to manage. And we sat with her and asked her why she was doing this. And the only thing that she could tell us was that all she could think about was how good it would feel for the blood to flow from her veins. And this is a person that psychiatrists were deeming to be sound of mind. In Canada, a person who is sectioned is legally held for 48 hours, and after that 48-hour hold, they need to have another psychiatric assessment. And my mom, of course, as a psychiatric nurse, knew exactly what to say to be deemed sound of mind. And so that's what happened. She was interviewed again. She told the psychiatrist what they needed to hear, and she was released. And 4 hours later, my sister and I received a text message from my mom's common law partner to tell us that she was dead and her body had been taken to a crematorium. One of the biggest challenges with the Canadian legislation, and I believe it's eerily echoed in the terminally ill bill in the UK, as well in Scotland, is that there is no clearly defined terms. And so there's a lot of ambiguity where people who are vulnerable can slip through the cracks. My mom was not terminal, but she was approved in the Canadian law as someone who was terminal because she was frail and because she was starving herself. And the way that our law is written, the words aren't exactly the same, but similar enough, where if a person is suffering from an intolerable condition that they deem to be intolerable to them, in the opinion of the doctor, they can be approved. And so although my mom wasn't terminal because she starved herself to the point that if she continued to go down that trajectory, that death would be imminent. And so doctors that are pro-euthanasia, pro-choice, can bend the law in a way that people like my mom, who needed help to live, was helped to die instead. In Canada, euthanasia was legalized in 2016, and we were told exactly what people in the UK are being told now, that the safeguards would be strict, that this would be people who were terminally ill, facing death in a reasonable time frame. Undetermined amount of time, really. In the UK, I believe it's 6 months. But what happened is that within 5 years, our law was expanded because people argued that their Charter of Rights were discriminated against because they were not facing death imminently, but they were suffering intolerably from a condition that was incurable. And so our laws within 5 years expanded, and what's now known as Track 2. So for people who are dying imminently, for terminal illnesses, Track 1, and now for people who are suffering intolerably, Track 2. And this sounds maybe great to some people in theory because we don't want anyone to suffer. But the problem with the ambiguous terms in the legislation is that for someone like my mom, because she was starving herself, death was imminent, but there's no requirement that a person has to go through treatment. So my mom was told that there was treatments available, but because she was obsessed with ending her life, with escaping her body, there was nothing that anyone could do to convince her to stay. My concern here in the UK is that people are being told the same things that we've been told, that the safeguards are going to be strict, that we need to trust our doctors, that we need to trust the system, that they're going to put these safeguards in place. But you don't get to decide how doctors are going to decipher the law, and you're also being asked to vote for a bill that hasn't defined any of these terms. And there's chasms for people to fall through, and vulnerable people will die. The Canadian legal system and the UK system are not that different. They're very similar in the fact that as soon as something comes into legislation, it has the opportunity to be challenged. And what has happened in Canada should be a warning sign to the UK, because euthanasia has only been legal for 9 years in Canada. And within 5 years, it was expanded beyond the terminal ill bill because people challenged that, and a judge agreed that this also was a discrimination to people who were wanting access to the eugenics program. And my struggle now is that with this expansion, they've included a sunset clause for people with mental illness alone as a sole condition. And so it's been postponed twice now, but as it stands in Canada on March 17th, 2027, people with a mental illness as a sole condition will be approved to die. And that doesn't mean now that people with mental illnesses can't be approved. If you have any sort of physical condition, having a mental illness in conjunction with that doesn't disqualify you. So it's a loophole, and a lot of people are being approved. For example, hearing loss, which is an incurable condition, curable in some, but you can't force people to have treatment for it. So you can be approved to die if you have hearing loss. If you have type 2 diabetes and you don't want to take your insulin anymore, that would deem you to be facing death, reasonably foreseeable if you stop taking that. So people with type 2 diabetes are being approved now. And people with these conditions who also have bipolar disorder, who have clinical depression are also being approved already. And Canada's also looking to provide access to mature minors up to the age of 12. And in the UK, similar to Canada, children already have, in areas of medicine, medical autonomy over their own body. So it's not a far stretch to say that children, mature minors up to the age of 12 who have a mental illness eventually won't be, will also be able to access this program. And it's naive for people here to think that it isn't going to happen exactly the way that it's rolling out in Canada, which is one of the most terrifying examples of how euthanasia can go wrong. We're talking about in 9 years, over 65,000 people have died by euthanasia in Canada. And the top two reasons people are citing are feeling lonely or feeling like a burden, which might apply to any elderly person, any person with a disability, veterans, a person like my mom who was just in crisis for a short period of time, and she was caught at her weakest moment. What I want to say to people in the UK is that this is an issue that cannot be rushed. This is an issue that you need to think very clearly about. Every single word needs to be scrutinized. There needs to be clear definitions. I don't know if there's a safe way that we can do this to make sure that we can protect vulnerable people. And frankly, it terrifies me. In theory, I would love to believe that there would be a way where we could live in a society where no one would abuse the system, that doctors had good intentions in every scenario, and that we could create safeguards that would protect the vulnerable. But what I know from my lived experience is that people abuse systems. There are doctors in Canada that are pushing the boundaries of the law so far that they're breaking it. And the police they aren't doing anything about it to stop it. One of the most prolific maid providers in Canada, who's killed over 1,000 people, self-admittedly, has over 14 allegations against her with the College of Physicians and has been named in 2 criminal negligence cases. And we do nothing. We do nothing. And so to sit here and think that we can create safeguards that will protect vulnerable people when we're looking at Canada right now that apparently has strict safeguards very similar to what the UK is proposing, and this is what's happening, I can't see a scenario where this can play out. I think it's a really big flaw in our healthcare system when doctors are providing death to their patients. I know of a lot of elderly people that are now afraid to go into hospital because they are afraid that they're going to be pushed made. Family members that are afraid for their elderly or vulnerable people to go into hospital. I know of a woman who spoke in the Canadian Parliament when they were looking at their expansion. Her dad, for an unrelated reason, went into the hospital, was diagnosed with COPD, and because he trusted his doctors, he didn't want to live out the rest of his days. He chose to die within 48 hours. The family had an autopsy, and after the autopsy, it was confirmed he did not have COPD. Nothing happened to the doctors because it just has to be in the doctor's opinion that this is the diagnosis. And so my concern is that people don't trust their doctors anymore to provide them care because they're worried that the doctors might actually provide death instead. People worry that maybe their life will be hastened to clear a bed because our hospitals are overflowing with patients. There isn't enough beds for people. I know that I don't trust the healthcare system anymore to protect people. But on the other hand, there's a lot of people that don't quite understand what happens. They don't understand the legislation. Most people, when you ask them if they believe that assisted suicide should be legal, they say yes. But when you ask them, do you think that a person who has anorexia should be approved? Do you believe that a child, a mature minor, should be approved? Do you believe that someone with dementia who gives advanced consent, and then when they get to this point where they don't remember their family anymore and they signed forms earlier in their life that when they reach this point they wanted to die, but then they say no in that moment, they still have to carry through with it? These are the examples of what people don't understand. And when you tell them about these issues, they don't actually support it because, again, in theory, we think that this is a lovely idea of autonomy, but people aren't dying these wonderful, peaceful deaths that's being painted in the media. And so for Canadians, it's a really big moral dilemma, and people are just ignorant. They don't know. They don't know until it affects them. In Canada, I'll say the media, but people that are pro-euthanasia have really, they've kind of created this culture around dying, that it's this beautiful experience, that you get to choose when you die. You can have a garden party. There was a department store, Simon's, that actually put out a commercial a few years ago, and it was pulled afterwards because of the backlash. But a young woman was dying, and Simon's department store sponsored it. And they had a beautiful beach scene with blankets and bubbles, and it was this amazing thing that glorified euthanasia. And my concern is that for younger people who are going through mental health issues, is that they're going to look to this and think, wow, what a beautiful experience. And what we know about suicide is that it is contagious. And by repeating this narrative over and over and over again, that it's becoming normalized, that people are thinking that this is the only dignified way to die, that a natural death might be painful or less of a good death, if that makes sense. And I never got the chance to say goodbye to my mom, to have the conversations that I should have had with her, because I spent the last week of her life fighting in courts to keep her alive. And my mom was so worried that she was going to lose her mental capacity to be approved for this, that she rushed into her death. And I had to say goodbye to my mom's frozen body in a crematorium because of this. And the IV was still inserted in her arm right above the incision where she tried to take her life days earlier. And there was nothing dignified about the way that my mom died. And so for people that are buying into this narrative, it scares me, because there is a dark side of this compassionate tale that we're being told. And no one is talking about it because it's traumatic and it's hard to talk about. My mom chose to leave us, and that is something that I will live with for the rest of my life. And I've been told by people that I shouldn't feel this way because it wasn't suicide. It was euthanasia. And that it was my mom's right and she was legally allowed to choose this. But that doesn't diminish my experience. And nobody talks about the effects on families. My sister and I have both been diagnosed with PTSD because of this experience. And I just want to say to people that if you want to really look at the big picture, you need to consider both sides of this. And I don't believe that Canadians have been given all of the information to make an informed decision. And I do not believe that people here in the UK have been given all of the information to make an informed decision. I can speak to my experience following along this journey in the UK. When I submitted evidence to the UK committee about my experience as a Canadian, it was weeks and weeks before anyone accepted my letter. And it was only after I started tweeting about the fact that no one was looking to other jurisdictions about what can go wrong that my evidence was accepted. And it's even more alarming that no one has brought forward any witnesses to hear our testimony, to know firsthand what can go wrong. The only people that they've been bringing forward are family members who have lived this experience where their family member, had the garden party, that kind of narrative. And I think it's very manipulative and very calculated to keep this information from MPs and from the UK citizens, because there's two sides to this story. And if you want people to make informed decisions and make a legislation that's going to protect vulnerable people, you absolutely need to be looking to other countries who are already doing this. And people might say, well, the UK isn't Canada, but you're not that different than us. We are all humans. And I can see how people are being brainwashed into this idea because they aren't being told the full truth. In Canada, when a person is euthanized, a doctor lethally injects them with drugs. And the deeply concerning part of this that I cannot understand is that there has never, ever, anywhere in the world, let me be explicit, there is no clinical research that has ever been done on the efficacy of these drugs being used at these dosages. And what I do know is that there has been research and review of autopsies on lethal injection patients in the US. And 88% of those autopsies found that the patient's lungs were filled with fluid. Pulmonary edema, meaning that these people who were lethally injected drowned to death in their own fluid. I also know that my mom's autopsy showed that her lungs were filled with fluid and that she drowned to death in her own bodily fluids. They say that a person's given a paralytic and they're unconscious when this happens, and so the death is peaceful. But there are cases that have gone wrong where the drugs weren't injected properly, where if people have woken up, the longest death took 137 hours. People have seemingly woken up from the drugs that were accidentally injected locally, screaming in pain when they wake up. the provider is traumatized. They can't find a vein, and this person's been taken to the hospital where they've been injected and killed there. And because there's been no research, we don't know if these people are lucid in their final moments, if the drugs sustain for the entire period while their lungs were filling with fluid. I don't know. And I will never know if my mom actually died a peaceful death or if she was suffering as her lungs slowly filled with fluid and she drowned. And so when MPs say that we need to trust the doctors and we need to trust the legislation, how can you trust that the doctors are going to make decisions on what drugs to use when no research has ever been done? It's not even trusting the doctors, because the doctors aren't even being given the correct information. The absurdity of this entire conversation is, there's no words. I'm speechless that we're even having this discussion. It's terrifying. What I have seen in Canada is that a society that views autonomy above all else is a society that no longer has compassion for people who are suffering, because it creates an ableist society where the only value is if a person is financially contributing to a society. And when a person gets older, or if they have a disability, or if they're having a mental health crisis, these people are looked down upon. And by allowing euthanasia, it sends a message to these people saying, we agree with you that your life is no longer worth living. And that is not a society that I want to live in, because I believe in humanity, and I believe in compassion, and I believe that we should support people. We should help. We should pick each other up. And I don't want anyone to suffer. That's not, I've been directly accused of causing people suffering because I am fighting against this program, and the people that are suffering who want to access this are frustrated. But the answer to me isn't that we need to allow people to have access to end their lives. We need to improve the healthcare system, have better research, and provide better access to people. My mom never saw the specialist in the condition that was listed on her death certificate. My mom suspected she had something called central sensitivity syndrome, which caused the tingling sensation all over her body. And she was scheduled to see a specialist for 2 weeks after she died. She was approved to die within a 10-day period from her first assessment to the first date she was scheduled to die. It was 10 days. And in Canada, you can die in 24 hours now. That is deeply alarming to me, because people aren't dying out of dignity anymore, or with dignity. They're dying because they're desperate, because they have been driven to the point where they feel like the only reasonable option is to die. People in Canada are accessing medical assistance and dying because they are facing homelessness and they have a disability. So they're having to choose between living in the streets or in their car with a disability, and death seems preferable. That's not an autonomous choice. That's a desperate choice. And this is what the system does. For a system that triages pain and suffering, you need to be at a desperate point in your life to get help quickly. And by providing death, it's easy. Anyone can do it, really. It's a very simple procedure, and you can just off people and remove them from the system because they're a burden. I know this is an issue in hospitals. I have spoken to nurses that are deeply alarmed because they hear doctors say things offhand like, well, we can just maid them. There are so many doctors and nurses that are concerned about this in our system because it is an easy solution when you can't figure out what's wrong with someone, or there is no answer, there is no cure for what they're going through. It is an easy way to lessen the burden on the system. And Canada blatantly provides financial reports on the savings. In 2021 alone, the government saved $89.6 million providing MAID versus palliative care. And that's just palliative care. We're not talking about the pensions that they no longer have to pay people. The government is saving billions of dollars by providing MAID. And I think that it's naive to think that, it's just all about compassion. Absolutely not. There are doctors on the pro side that are excited about this by providing patients with what they want in the moment. I know in Canada, there are several prolific doctors that have actually talked about feeling euphoric after they provide death to someone, that it's the best work that they've ever done, and they're excited about it, and that is alarming. There's nothing that I can ever do to bring my mom back. But what I choose to believe is that if I can save one life, for every life that I can save by speaking out and telling her story, it helps me to make sense of her death. Because my mom was a psychiatric nurse who cared deeply about human beings and about healing. This to me is her legacy. And the reason I've come to the UK is to warn people here about the dangers of what can happen when you don't ask questions and when you rush something. Because I wish that in Canada we had stricter laws and better safeguards. Because if we did, my mom would still be alive. And she had so many years left to give and to love. And my family is torn apart because of this. We have lost everything. She was the glue in our family. And if I can save anyone from having to go through what we've gone through, then all of this is worth it. For the MPs that are voting on this important bill, who maybe thought this was a good idea in theory, I would ask them to really think about what this bill means and who is going to be able to access the program. Because it's not just about the bill now, it's about the expansion that will definitively happen. I want them to think about it and think about their families. I want them to think about their daughter or their son. I want them to think about maybe their best friend or the people that they just love more than anyone in the entire world. If they could think about that person when they're voting for this bill, and they could think about that person who was desperate to get help for care, but they couldn't, and so they chose to die, and think about what they would do to stop that in that moment, because there was no roadmap for my sister and I. It was the Wild West, and it still is. And we didn't save her, but we kept her alive for 3 more days. And if they could just vote now to vote down a bill that leaves so many cracks for these people to sneak through, maybe they won't be put in that position in the future, that they can stop it now before it's too late. Because once this goes through, once you open this door, you do not get to decide who walks through. And it's not a matter of if you will be affected by this, it is a matter of when. Every single person will be affected by this, one way or another. And the MPs can't think about stats. They can't think about numbers. There are real human beings and real families behind every single one of these numbers. And that's what I want them to think about when they vote for this. I know from personal experience, there are dozens of family members that have just personally reached out to me alone that are cheering me on from the sidelines, but they are so traumatized by their own experience that they can't speak out about it. Or they don't want people in their professional life to know what's going on, and so they're afraid. Or other family members have told them just to let it lie and not say anything. And they've already lost a loved one. They don't want to lose other family members because they're speaking out and the other family members don't understand why. It is a very lonely road to do this alone. And I know of these other families, and I carry them with me, and I carry their loved ones with me. And even though they are afraid to speak out, I speak out for them. And my hope is that by doing this, I can give other family members the courage to speak out about this, because it is important. And if I, as one person, have been contacted by dozens of families, I know there are hundreds of us out there that have experienced this. And I want people to feel safe and to feel loved. And it is a scary thing to put yourself out there. And I think that is one of the biggest reasons why people don't. And it's a large part of the reason why the narrative is being spun that it is this beautiful experience, because it's much easier to talk about the happiness, or for the people that are justifying it maybe. I don't know how someone could sit with a family member and watch a doctor inject drugs into their veins to stop their heart. I don't know how they could see that as a peaceful, loving experience, but I think when you go through something traumatic like that, you need to convince yourself sometimes.
Do you think the MPs are being misled?
Absolutely. I think MPs are absolutely being misled in this. You cannot make an informed decision without all of the information. And the information is strategically being kept by not allowing people like myself to speak out about our experience because it doesn't align with their goal. And their goal is to pass this bill.
And if an MP has any doubt at all, what would you say to them?
If an MP has any doubt, don't vote yes for something that you have any doubts about. There's no reason why this needs to be rushed. There's no reason this needs to be rushed. We need to ask better questions. We need clinical research. There's no other area of medicine where we would roll something out without clinical trials and research. Yet euthanasia, which is being considered as part of healthcare, which is ironic, that we're rolling something out when this is literally a life and death situation. We're rolling this out with no clinical research. How can you vote yes for something like this? I think when you consider people who are suffering at the end of their life, and we need to consider whether or not allowing them access is worth allowing vulnerable people to also die, is a really big moral dilemma. You know, I think about this a lot, and, you know, losing one person who should live. I think about my mom's life a lot. And I really do believe in palliative care and in pain reduction, and it's so difficult for me because I know that the alternative is not actually a peaceful death, and I don't want anyone to suffer. And so when I think about these people that are being lied to, being told that they can escape their suffering and have a peaceful death, when no one can guarantee that because there's been no clinical research ever done, I just feel like everyone's being duped. And if you have any surgery or any medical treatment, there's a list of contraindications and complications that could arise, and you have to sign off on this, and it's transparent. But there's no transparency in what these medications do to people. And so I really struggle when I think about people suffering at the end of their life, because the alternative might just be more suffering. So I don't know how to reconcile it. I think it is a really big concern that palliative care is underfunded. And when we look at it in the context of euthanasia, there's less reason to fund palliative care, because why would people need palliative care if they can just have their lives ended? It's really unfortunate, because I don't actually think people really understand palliative care and what it is, that it is an area of medicine that relieves suffering when done well, and that you can have a beautiful, dignified, pain-free, natural death. And what we've been told is that, or what they're spinning, is that a natural death is the opposite of a death by euthanasia, which is peaceful and lovely, therefore a natural death, is horrible and horrific. I know so many people that have had amazing, beautiful experiences in the last weeks of their lives because of the time that they got to spend with their family, letters they were able to write. And it was this beautiful experience. We think about pain and suffering, and people try to avoid this at all costs in our society now because they're afraid. But also, we don't consider the mental health as well. And I think it's really important for people to have more discussions about death and dying, because we don't talk about it anymore in a society, and people are just so afraid of it. And palliative care provides such an important role in an end of life, and euthanasia does take away from that.